Hello, I'm State Representative Robert Sprague from the 83rd House District. Welcome to Ohio in Focus.
Hello and welcome to this edition of Ohio in Focus, a program that brings state government to you. I'm Brad Miller, and I'm pleased to be joined today by State Representative Robert Sprague, who serves the 83rd House District, which includes Hancock and Hardin counties, as well as parts of Logan County. Representative, welcome back to the show.
Thanks, Brad.
We're going to talk today about a series of bills that you have introduced, still on the topic of tackling Ohio's addiction to prescription drugs and opiates. Can you give us, before we get into those bills specifically, can you talk about the background, where we've come from in this battle against drug addiction in Ohio?
Sure. I mean, we've made progress, but there's still a lot of work to be done. Some of the things we've done in the last General Assembly, we made sure that prescription drugs are being destroyed by hospice after somebody passes, make sure that prescription narcotics don't get out onto the street. We've made sure that narcotics aren't being prescribed to children without their parents' knowledge or consent. We've increased the penalties to drug dealers for selling heroin to pregnant women. We've shut down doctor shopping in the state of Ohio. We've made sure that on the treatment end that the full continuum of care is available to people as they seek to recover from drug addiction, opiate addiction in the state of Ohio. We've invested money in our drug courts. We created a medication-assisted treatment pilot program in 5 counties, which has met with wild success, and we're going to extend that further. And then we've also put in prescribing guidelines as a state as to how to prescribe these prescription narcotics through the medical system and do it more responsibly for certain aspects of prescribing.
And that brings us to these bills that we're going to talk about today, 4 in all. We're going to start with a Good Samaritan bill. Can you give us some of the details of that bill? Sure.
The Good Samaritan bill is very simple. In 2013, which is the most recent data that we have for overdose deaths, sadly enough, we saw a 10% increase in the number of people who died from overdose deaths over 2012. And nearly half of those are from heroin overdoses. And one of the reasons that people die from heroin overdose is because when they're using and they overdose, everybody runs away because you're dying and nobody basically wants to be found at the scene of the crime because they're afraid of being arrested. And so in that scenario, you've got one person who dies, the user, and you've got a whole bunch of other people that have run off that you never get to prosecute or talk to. They disappear. So what the Good Samaritan bill does is it says, look, we're not going to prosecute you for minor drug possession if you call in and call 911 and save somebody else's life from a drug overdose. We'll still be able to go after the bad guys like the drug dealers. It simply gives people immunity from prosecution for minor drug possession so that they have an incentive to do the right thing and save somebody's life.
And who have you talked to? I'm sure law enforcement and has been active with your office in working this out.
Sure, I think law enforcement, I can't say for every law enforcement official, but in general, they understand the overdose epidemic that we have in the state, and they're looking for tools to help solve it. And for the most part, they'd rather see people alive than find them dead from an overdose. And I think they'd like for us to tackle not just when somebody's all the way at the end here, when they've already overdosed, but they'd like for us to move back to the very beginning and try to help prevent people from becoming addicted too.
But in those instances, it does give people one last chance, rewarding them to be responsible at least at that moment.
Well, in a lot of cases, that's a game changer for people because they've had a near-death experience and they're ready then to seek treatment and recover.
Another bill that you have introduced is an abuse deterrent technology pill bill. I'm sure that requires some description for people.
Right. Well, I'll tell you what it is right now, we talked about those 2013 overdose deaths. Well, nearly a third of those came from prescription narcotics. And the way that you overdose or abuse a prescription narcotic is you take one of those pills and you crush it and then you snort it or dissolve it in water and inject it. And what this abuse deterrent technology does is it basically prevents those pills from being crushed. So one technology out there is kind of like a jelly bean. You can imagine trying to crush a jelly bean and then snort the jelly bean. You know, that doesn't work. Another is, I think they've got like a naloxone core. Naloxone is the antidote for an opioid. And so when you crush it and it releases that antidote, you can't get high from the opioid in the pill. So there's several different kinds of formulations out there. And what the bill does is it simply says, look, we've got this new technology coming online that can prevent somebody from abusing one of these pills and overdosing from it. And we're going to make sure that it's covered by the insurance plans so that it's available for people to use.
And you mentioned prescription narcotics. That's excuse me, a third bill that we're going to talk about. It addresses some of the time intervals in which pills can be prescribed. Can you go into further detail on that?
Sure. You know, one of the things that we found is that the root cause of our heroin epidemic in the state of Ohio is the massive amount of prescription narcotics that are coming out of our medical system. And you can draw basically a graph, and you can see where the number of overdose deaths almost exactly corresponds to the increasing dosages of these prescription medications coming out of the medical system. And if you think about it, it kind of makes sense, because the way that people get addicted to opiates is they start out abusing the pills, and then as their addiction deepens, they turn to heroin, which is stronger and cheaper. So everybody pretty much starts out on the pills for the most part. What we are trying to do is limit the amount of prescription narcotics that are coming out of the medical system. We have got to do that if we want to solve the heroin problem in the state of Ohio. So what this bill does is it creates a check for medical necessity to make sure that it's medically necessary to continue narcotics prescription past 10 days. That it's medically necessary to prescribe more than 80 morphine equivalent doses for a chronic pain patient. That it's medically necessary to prescribe more than 3 days supply out of an emergency room. Just to make sure that we've got medical justification for these prescriptions, which are flooding the market and in a lot of cases, unfortunately, killing our young people.
The final bill, and obviously these are all part of a package, but I think it makes sense to say that this is the final stage of these bills, addresses the continuity of care and moving forward. What is this bill about?
This is dealing with treatment, and so this is for individuals. We want to make sure that their availability to go and seek treatment and try to get into recovery and kick their addiction, we want to make sure that they've got an appropriate access to that treatment system. And one of the things that's been proposed in the budget is carving in or allowing the large managed care insurance companies to now pay for all the behavioral health services. So whether it's mental illness or addiction counseling. And we have, as a part of this bill, introduced some guardrails that make sure that service won't be interrupted to individuals as they seek help, to make sure that there aren't going to be limitations placed on the amount of counseling or the amount of services or medication that they can get to help deal with their mental illness or a drug addiction issue. And to make sure that the transition as we move from, in a lot of cases, just a direct fee-for-service billing to a much more complex billing system for these providers, to make sure that there's no drop in coverage during that transition. So it kind of sets up guardrails around the behavioral health system to make sure that it works correctly under the managed care model.
The district you represent is largely rural, as is that, excuse me, that part of the state. You are co-sponsoring some of this legislation with a member who represents a mostly urban area in Cincinnati. And I know you both have talked about this in the past, and I think people are becoming more aware of the problem. Mm-hmm. Unfortunately, you see things in the news all the time. Mm-hmm. But can you kind of talk about, this isn't just an urban problem, it isn't just a rural problem, it really is kind of spreading the whole, across the whole state.
No, it's everywhere. And you know, you can see that since 2001, if you go through and you look at it on a county by county basis, you can see how this has spread from an isolated few counties in 2001 to absolutely across the entire state by the year 2011, and that's 4 years ago. So it obviously is spread to every nook and cranny of the state, unfortunately. And in a lot of cases, this is not an inner city problem. It's a problem that's affecting our young people in the suburbs, in our small farming towns and villages, in our medium-sized cities, as well as the large urban areas. Nobody is immune from this. Doesn't matter what the color of your skin is, or your socioeconomic status, or what your level of education, or your athletic ability. This drug doesn't care about any of that. It works on your mu receptor in your brain, and it doesn't care who you are or what kind of background you have. It works the same. And so we are seeing that addiction roll across the entire state. And that's why I'm very pleased that Representative Driehaus is going to be a joint sponsor on these bills, and she comes from Cincinnati, an urban area. I come from Northwest Ohio, a rural area, and we're going to tackle it together.
We have just a couple minutes left. At the end of the program, we have our guests share with their constituents back home how they can reach you here in Columbus.
Mm-hmm. Well, I appreciate that. Thank you very much, Brad. Again, my name is Robert Sprague, State Representative for the 83rd House District. You can email me at rep83@ohiohouse.gov, or you can call me at 614-466-3819. I look forward to hearing from you. Thanks, Brad. Thank you so much.
Always look forward to hearing from you as well.
Thank you.
And we look forward to seeing you again on the next edition of Ohio in Focus, a program that brings state government to you. Thanks for watching.